So for knee flexion and extension, range of motion, your patient's gonna be in the same position. So they are supine on the table, okay? For extension, normal range of motion should be 0. So when you do your measurement, the axis is gonna be on the lateral epicondyle of the knee. Movement arm is pointing down towards the lateral malleolus, and then the stationary arm is going to be midline up to the greater trochanter. Okay? So in this position, you're basically just making sure that they get to 0. Can you bend your knee as much as you can? So for here, she's going to flex, flex, flex. It's okay if they bend their hip a little, but as long as they're in range, if you want to have them come down, you can do that too to make the measurement easier. For some people, depending on tissue mass, they might have to keep their leg lifted to get that final in range. That's okay. Okay? You're not as worried about the hip as you are about the knee. So in her case, she can bring that foot down. Your landmarks are the same. Coming down to the greater troch. Coming down to the lateral malleolus, lateral epicondyle of the knee for the axis, and she has 149 degrees of knee flexion. If she was lacking knee extension, so let's say that's as straight as she can get it, okay? She can no longer reach 0. You're gonna measure the angle. So if you look here, she's got, what is that, 37? She is lacking 37 degrees of knee extension. That is negative 37 degrees of knee extension. Okay? If you were to say what her active range of motion is, now this is your starting point. It's no longer 0 to, what did I say, 147? It's no longer 0 to 147. Now it is 37 to 147, and that would be her active knee flexion. Good? Good.